Hello, my name is Dr. Arandi. I'm assistant professor in psychiatry in Palestine. Today I will present a very important subject, which is the beta blockers. Beta blockers, as we know, it is very important drugs. For example of these drugs, let us say about propranolol. Propranolol has many trade names, such as Deraline, Inderal, and others name. Propranolol, it is non-selective. It has two receptors, or more than two receptors, B1 and B2. B1 is found in the heart and B2 in the lung. With regarding to its action, it is block the receptor. These receptors, it is non-selective, so it is can antagonist the action of noradrenaline and epinephrine. The presentation of this drug, it could be as a slow release or rapid action formula. It is rounded from 60 milligram, 80 milligram to 120 milligram up to 140 milligram. The half-life of the propranolol is about 3 hours. The efficacy of the drug is after a few weeks. When we stop the medication for any reason, we should stop it gradually to avoid gradually, and this should be taken at least 1 week if we want to stop this medication. The indication of propranolol, it has organic, physical indication, and in psychiatric indication. For the organic indication, it is used for hypertension and for the cardiovascular diseases, which include the heart, and other conditions. Can be used in thyrotoxicosis, in pheochromocytoma, and other disorders and other diseases. Regarding to psychiatric disorder, which is my subject actually, we can use it in migraine, cluster headache, in cases of benign essential hypertension, in tardive dyskinesia, in akathisia. We can use it in panic attack, performance anxiety, and social phobia, in frequency of urination, and other cases. Propranolol, it is a good drug, but unfortunately, it has some side effects, which include orthostatic hypertension, hypotension, could cause nausea, vomiting, diarrhea, sometimes constipation, and general malaise. It is preferred to take the dose of propranolol at night because to avoid the side effect of orthostatic hypotension. We should be cautious when we take, or maybe contraindicated in cases of asthma, and in cases of glaucoma, and in cases of heart failure, kidney failure, liver failure. Propranolol, it is used in performance anxiety when we have any serious meeting or important meeting. Could be social meeting. We can use it as in performance anxiety. 1 hour before the onset of the event, can slow down the activity of the sympathetic system. As we know, Adrenaline, it is the core neurotransmitter in the sympathetic nervous system, which is reactive in cases of all type of anxiety and other stressful situation. Sometimes it is good for slow down the rates of the drug, the rates of the heart, and it increase the force of the heart. So, when in these cases in the disorder, if there is overactive for the sympathetic system, we use the beta blocker to decrease the efficacy of noradrenaline and subsequently decreases the efficacy, decreases the symptoms and signs of the anxiety. I don't know if I mentioned its uses in migraine and in cluster headache, impulsive control disorder, in panic attack, and in tardive dyskinesia, akathisia, and intermittent explosive disorder, and in benign essential tremors. Frequency of micturition is the best drug. Thank you for your listening.